Hello, Mr. Lawler. Siobhan is my name. I'm a member of the team here today. Can I confirm your name and your date of birth, please?
Yeah, it's John Lawler and it's the 7th of June 1994.
Thank you. Would you prefer if I called you John or Mr. Lawler?
John's fine, thanks.
Thank you. John, we'd like to take a specimen of arterial blood from you today. Have you had this taken before?
I've just had a normal blood test.
Okay. It differs from a normal blood test in that we will take a specimen of blood from your artery at your wrist. It is more painful, but we will be as quick as we can. Do you have any questions for me?
No.
Do I have your consent for the procedure?
Yes.
Thank you.
For radial ABG, check ulnar circulation adequacy by squeezing the hand into a fist, occluding the radial and ulnar arteries in the wrist. Holding for 10 seconds, then opening the hand and releasing the pressure on the ulnar artery only. Look for reperfusion of the whole hand. This is called Allen's test. Now we will demonstrate how to perform ABG. Rewash hands and wear non-sterile gloves. Position the wrist in extension on the pillow. Next, palpate the radial artery along its length using the middle and index fingers. Choose the site for arterial puncture. Now clean the skin with an alcohol wipe. Place an index finger on the radial pulse. Now hold the syringe like a pen with the bevel facing upwards and proximally. Warm the patient and insert the syringe at 45 degrees to the skin, aiming for the centre of the artery against the direction of blood flow. Once you hit the artery, the blood should pulse into the syringe. This is the best method of assessing whether blood is arterial or venous. Then apply pressure to the puncture site with a cotton wool and withdraw the needle. Press firmly for at least 3 minutes. Remove and discard the needle using a sharp bin. All air bubbles should be removed from the sample and the syringe should be capped. After pressing firmly for at least 3 minutes, use a cotton ball and tape in order to appropriately cover the puncture site.
To complete the procedure, we will thank the patient, making sure that they're comfortable. We will discard our equipment appropriately, wash our hands, and document the procedure in the patient's notes.